Aortic valve is a valve between the left side of the heart, that is the left ventricle, and the main artery which is supplying blood supply to the entire body, that is the aorta. So the valve between the left ventricle and the aorta is called the aortic valve. The function of any valve is to allow the blood to flow in a single direction and to prevent the backflow of the blood or the back leak of the blood. So the aortic valve allows the blood to be pumped from the left side of the heart to the various organs of the body via the aorta. Because this valve guards the aorta, it is called the aortic valve. Aortic valve has got 3 leaflets. So these 3 leaflets together they form the aortic valve complex. Narrowing of the aortic valve is due to accumulation of the cholesterol plaque on the aortic valve leaflets. Just like blood vessels accumulate cholesterol and get hardened, leading to reduction in blood supply and causing heart attack, identically the aortic valve gets thickened with progression of the age, and which leads to restriction of the mobility of the valve leaflets and finally to a narrowed aortic valve orifice. All these put together cause a scenario where the blood flow to the various organs is reduced when the aortic stenosis becomes quite severe. Aortic stenosis means narrowing of the aortic valve, and if the severity is more, there is a reduction in the blood supply to almost all the organs of the body, including the heart. What causes aortic stenosis? As we have understood, aortic stenosis is a progressive narrowing of the aortic valve due to cholesterol accumulation and subsequent hardening of the aortic valve. So people as they age, they develop cholesterol accumulation in the blood vessels and similarly on the aortic valve. So the most common reason for the development of aortic stenosis is advancing age or progression of the age. So at what age does it happen? Usually people who develop symptomatic aortic stenosis, they develop symptoms in between 75 to 85 years of age. That is the age where there is a narrowing of the aortic valve consequent to thickening of the aortic valve. Then the other reason is people who are born with a congenital aortic valve problem. That is what we call as the congenital aortic stenosis, but it is quite uncommon in our day-to-day observation. So people who have a defective valve from birth also can develop a aortic stenosis. The other very important cause for aortic stenosis, what we see in our life is instead of the 3 valves of the aortic valve, we have got only 2 valves. So this is what we call as the bicuspid aortic valve. So whenever there is a bicuspid or 2 leaflets only instead of the 3, that will also lead to an accelerated narrowing of the aortic valve. So whenever those people develop a narrowing of the aortic valve in between 60 to 70 years of age. In India and especially in the Asian countries, the narrowing of the aortic valve happens much earlier, between 65 to 75 years, instead of the Western countries where it is 75 to 85. It happens 1 decade earlier because about 30% of our aortic stenosis patients are due to the bicuspid aortic valve. Due to some reason which we do not know, people of the Asian ancestry tend to have a bicuspid aortic valve, which can make the valve prone for an earlier damage. So apart from the important reasons what we have seen like aging related degeneration, bicuspid aortic valve and congenital aortic stenosis, certain diseases can have an accelerated progression of the disease, they being diabetes, chronic kidney disease, heart failure, and also associated blocks in the heart vessels which have been either operated by angioplasty or bypass surgery or not even operated. So those are the other risk factors for the development of the aortic stenosis. Let me summarize once again for you. People who have got elderly age, people who have got bicuspid aortic wall, people who have got congenitally or a defective aortic wall from birth tend to develop aortic stenosis. But in addition, people who have got diabetes, kidney failure, people who have got a blocks in the heart vessels supplying the heart, or whenever there is a pumping dysfunction of the heart, those are the scenarios where there could be a aortic stenosis development, and this progression of the disease also can be much more rapid. Aortic stenosis is a disease which in the early phases does not lead to much of symptoms. So this leads to the diagnosis of aortic stenosis in a quite advanced phase. So people who have got aortic stenosis because the blood flow is not adequate to the various organs, that leads to breathlessness or sometimes chest pain, because even the heart also is not getting good blood supply, and sometimes the brain also is not getting good blood supply, so the person can fall unconscious. So these are the three common symptoms for a patient with aortic stenosis. Having said that, what we see is we do not see these classical findings of chest pain, breathlessness or loss of consciousness, but instead what we see are symptoms of heart failure. So majority of the time people with aortic stenosis tend to get admitted into a hospital with heart failure. So the symptoms what we see in 2023 are different from what we used to see in the past of like chest pain or syncope, but whereas right now we see more and more patients with heart failure getting admitted secondary to severe aortic stenosis. The diagnosis of aortic stenosis is a stepwise diagnosis. When they approach a doctor, examination with a stethoscope, usually the doctor will be able to identify a murmur. This diagnosis of aortic stenosis can be confirmed with the aid of a echocardiography. The diagnosis is much more precise compared to a routine echocardiography, where the presence and the severity of aortic stenosis are misinterpreted. So clinical examination with a stethoscope, echocardiography. Following that, if we are sending the patient for surgery, then we usually perform an angiography to look at whether there are any blood supply reduction to the heart. Finally, if the patient is going for a treatment using a transcatheter aortic wall replacement or a TAVR therapy, we will be able to assess the dimensions of the heart and the aortic valve precisely using a CT scan or a CT angiography of the aortic valve. So in conclusion, simple tests like physical examination with a stethoscope is helpful to suspect, echocardiography to confirm the diagnosis, and CT angiography to plan the therapy and choosing the right sized valve are required. If the patient is going for a open heart surgery, then at times we do a angiography in the cath lab to identify the presence of any blocks in the heart vessel supply. Treatment of aortic stenosis is based upon the symptoms. Any patient who has got symptoms, they need to be treated immediately, because if they don't get treated early, about 50% of them die in the next 3 years. So aortic stenosis has got a very high risk to life, and most of the time the risk to life is quite sudden, and once the patient with aortic stenosis has got a cardiac arrest or a heart attack, it is very tough or very difficult for us to save these patients. So that is the reason why we need to treat these patients much earlier. In addition, people who have got a low heart pumping, people who have got a severe narrowing of the aortic valve, those are the people we need to treat aortic stenosis. So what is the treatment of aortic stenosis? The treatment of aortic stenosis is the replacement of the damaged or the narrowed aortic valve. So this damaged or narrowed aortic wall is a mechanical problem. That means it's an obstructive problem. We will be able to treat it only by removing the obstruction, but not by using the medicines. So treatment of aortic stenosis is replacing the God-given valve or the native valve with an artificial valve. So this artificial valve can be installed into the heart or implanted into the heart using a non-surgical approach. That means we pass the aortic wall through the leg into the aortic wall and expand the valve. So that is the treatment of aortic stenosis without open heart surgery, called as the transcatheter aortic valve replacement, or in short form TAVR or TAVR. For people who are less than 60 years of age, TAVR is not the right therapy. So in those patients who are less than 60 years of age, an open heart surgery might be required for these patients. So in this also, the through an open heart surgery, the damaged aortic wall will be replaced with a artificial valve. So once we remove the aortic wall and replace with an artificial valve, if the person is less than 60 years of age, we use a metallic valve. So these metallic valves last for almost 30-40 years. So for people who are younger, metallic valves with open heart surgery is the treatment of choice. For people who are more than 60 years of age, and especially for those who are more than 75 years of age, it is preferable to use a non-surgical approach in the form of TAVR or TAVR. For people who are younger, open heart surgery or SAVR is the treatment option for these patients. In addition, treatment of diabetes, hypertension, obesity and lifestyle modifications are essential for the treatment of the aortic stenosis and preventing a repeat narrowing of the aortic valve. Prevention of aortic stenosis is by taking good control of cholesterol levels. LDL cholesterol should be less than 70, especially if a person is diabetic. Good control of high blood pressure, good physical activity, and reduction of obesity. So these are the 4 main lifestyle modifications which are required to prevent the development of aortic stenosis. But once after the development of aortic stenosis, that means aortic stenosis is already set in, we can prevent the faster progression of the disease by treating heart failure well, treating cardiac risk factors well, but most importantly, we need to treat the existing heart vessel blockade, that is what we call as the coronary artery disease. That means people who have got an associated blocks in the heart vessel also have to be treated early and well to prevent the progression of the aortic stenosis. Finally, if the patient has got associated heart failure, treatment of heart failure to prevent the progression of aortic stenosis is of paramount importance.